Suma, I'm from Dharwad. I'm working as associate professor in SDM Medical College. Sir, my doubt is in when you do a hysteroscopy and you find that the cavity is small, do you believe in lateral metroplasty or no?
I don't believe at all, but a lot of people are doing. We have come to a point when you put in first of all, hysteroscopy should never be carried out.
Previous IVF failure and all, if you want to see.
Yes, in that case, maybe RIF or implantation failures, um, it is not fully recommended, but you can do it.
Yes.
We have come to a habit. The moment you put a scope inside, we just put scissors and start cutting here and there. We should never touch the cavity. And lateral metroplasty has got no proven role in. I think we should give. Why does a woman have a small uterus? That's the question which comes to my mind. It is due to it's due to hypoestrogenemia, or how many women are born with a small uterus? I don't know. Women are not born with a small uterus. It's only because when they're having premature ovarian failure or DOR, then their ovarian reserve comes down, E2 level comes down, and cavity becomes small.
Smaller. Yes.
But I think you should give her more estrogens, make her bleed more, and then when she has 4-5 cycles, her cavity will become adequate. And how do you know it's a small uterus? Have you seen the cavity volume? Do you do vocal for a? So we should look at. Don't go by के uterus छोटा है. Go by the cavity
Volume.
mapping. So cavity volume, how do you do something called vocal? कुछ नहीं करना होता. आजकल मशीनें बड़ी सुंदर मशीनें होती हैं. यूट्रस पर डाला, एंडोमेट्रियम रखा हाथ के साथ. With finger only we just cut sections. On my machines for a 3D, I don't use any buttons, only finger. Focus the uterus, cut. Wherever I want, put a circle and 3D वहाँ का हो जाता है. Every follicle is जब tap a follicle and get the volume of the follicles. So cavity volume, madam, is more important. And cavity volume more than 3 cc is a good. Uterus may be small, but cavity is good.
No, so
It's
she
okay.
had persistently thin endometrium, so I had to do a hysteroscopy
Very right,
to
ma'am.
see what it is. That time we felt the cavity is small. That time I wanted to know your
So it's nothing called feeling. That's what again I'm saying. Stop feeling. Document by a 3D scan her cavity volume and her uterine cavity, sagittal and cornal views. If you feel it is due to by birth. No, this woman, was she having her periods routinely?
routinely, regular, sir.
And thin 80 she had.
हाँ sir.
Then why did she have thin 80?
HRT cycle करने वक्त ET never went beyond 6.5 millimeter.
So I think अगर uterus thin है, cavity volume कम आ रहा है, then you can do lateral metroplasty. But when you give a nick here and there is okay, but there is no recommended. It is not recommended to cut uterus to do lateral metroplasty. Many people do it. We don't.
So for adenomyosis, do you do adenomyomectomy or
Never.
Then if you have to do embryo transfer, then sir.
So this is again a very good question. It's a burning question. In case I hate something in my patient, that is adenomyosis. And adenomyosis will always somehow connect with the endometrium because it is arising from endometrium only. In the morning I spoke about forest chart. What is the forest plot? What is the forest plot? क्या होता है? How does a tree look like? Tree and ऊपर it is got bushes, branches. When you turn this like this,
Adenomyosis.
it become a forest plot because यहाँ पे diamonds are there, diamonds, and so they are the branches of this. So a tree has been turned towards left or right, it becomes a forest plot. Just the way I say when you do the plotting, it's a reversing of this. What was the exactly question?
Adenomyosis में आप
So always branches or pen here. It's always a connection. Adenomyosis, there's always a connection between the endometrium. So endometrial myometrial junction is the one which we have to see. And to see that, we have to look at a 3D scan only. You'll find budding of the endometrial myometrial buds आते हैं, webbing आती है. That is, you just have to keep your probe there, TVS probe there, draw a circle, and you'll get disruption of the endometrial myometrial junction. There's a possibility that adenomyoma is jutting inside the uterus. That is the rare possibility. It's formed a sort of a polyp. Then of course you have to do a surgery. But ऐसा rare होता है. Adenomyoma doesn't jet inside and form like a myoma jets inside. Adenomyoma it will disrupt the cavity only. It will grow towards myometrium. So adenomyosis, in my perspective, which I do a lot of scans, they grow towards myometrium. And fibroids tend to grow towards the
Cavity.
endometrium. ठीक है? So the right thing, beta, here will be giving them Marina.
Marinas.
Give them Marina for around 4-5 months, or you can give them Zorodex. You have to suppress the activity of adenomyosis. Then you can go in for an
Embryo
embryo
transfer.
transfer. But whenever you are dealing with a case of adenomyosis and doing an embryo transfer, always do under suppression. And endometriosis, adenomyosis. PCOD, do HRT cycle under suppression. So Marina is the right thing. Put them on OC pill, put them on some sort of suppression, but don't do
Surgery.
until you have done 3 to surgery का तो role नहीं है.
नहीं.
Until they're symptomatic, don't go in and carry out surgery because they'll lose a lot of uterine mass. Some people do surgeries, but surgery is the last option we have. Because they don't interfere with your pickups, they don't interfere with your
Transfers.
embryo transfers in case you have suppressed them well. But outcome is always poor in adenomyosis. But doing a surgery also won't give you better outcome. Surgery won't give you any magic, no? Then why to do a surgery?
Yes.
So we don't operate adenomyosis, we don't operate endometriomas, we don't operate dermoid. Because surgery won't give you any benefit, that's all.
Okay.
And they will cause more damage because you will, in an adenomyoma, a diffuse adenomyoma, you will remove so much of adenomyoma and the uterine muscle will become weak, number one. Number two, in case you remove an endometrioma, then you will lose cortex and the follicles will be lost. This is the way we look at these things.